Proposition 8, Dialysis Clinic Profit Limit. Should outpatient dialysis clinics be required to rebate money to private insurers if their revenue exceeds allowable costs by more than 15%? People suffering from end-stage renal disease, the final stage of kidney disease, must receive dialysis to survive. Dialysis filters out waste and toxins from blood. It is typically done in a chronic dialysis clinic 3 times a week, with each treatment lasting up to 4 hours a time. These clinics are licensed by the California Department of Public Health using federal certification standards. Approximately 588 licensed clinics operate in California. The majority of the clinics are owned and run by one of 2 private for-profit companies. Estimated annual revenue of the private companies is $3 billion. Most dialysis is paid for by Medicare and Medi-Cal. These programs pay a fixed rate established by the regulations and are close to the average cost of treatment. Private insurance also covers dialysis, with payments rates fixed by negotiation with the providers. On average, those rates are multiple times higher than that paid for by the government programs. This proposal requires the companies that own clinics to rebate certain payers, mostly private insurance companies, if the clinic chain's corporate annual revenues are more than 15% higher than a cap defined in the proposition. The cap is based on the total allowable costs of direct patient services care and healthcare quality improvement costs. The costs of non-managerial staff salary and benefits, drugs and medical supplies, staff training, patient education, and electronic health information systems fall within the cap. Certain staff, such as medical directors and nurse managers, are required by federal law. It is not clear if such staff falls within the allowable cost category. Adjustments to the amount of the cap are allowed if the clinic operators prove to a court that the revenue cap is so low that it is an unconstitutional taking of the value of the business. The challenger bears the burden of proving that the cap would be appropriate. Fiscal effect. The fiscal impacts of this proposition are dependent on the response of the clinics to it and on the interpretations of what allowable costs are by the Department of Public Health and the courts. It appears that initially rebates will be paid, which will reduce the profits of the clinics. The impact on state and local governments vary from a net savings of tens of millions of dollars to a similar net cost. That gives us an idea that this is really unknown. Those who support this initiative say, Proposition 8 provides incentives for dialysis clinic companies to lower their costs and improve the quality of patient care, and that when insurance companies are charged less for dialysis, the overall cost of insurance will decrease for everyone. The supporters are essentially a healthcare workers' union. Those who oppose the initiative say that Proposition 8 sets arbitrary limits on what insurance companies pay for dialysis treatment and will not cover the complete cost of running a clinic. That therefore clinics will reduce operations or close, depriving patients of access and increasing the risk of poor medical outcomes. And those who are paying to oppose the measure are essentially the clinics themselves.